A big hello to everyone who is listening to this little online chat. Here at One Door, we've started a new project called Free Your Mind, and it's a quarterly project where we will release a recorded discussion with people in or having knowledge of mental health and mental illness, particularly people with experience of mental illness. We hope to cover a wide range of topics, including research, advocacy, service provision, lived experience, and well-being. Today, I'm very excited to announce that we'll be talking to Professor Niels Buus, Associate Professor Andrea McCloughen, and Farrell-Whelan on the topic of open dialogue. Before we begin, I think that we should do an acknowledgement of country. I would like to acknowledge the traditional custodians of the lands on which we meet and pay our respects to their elders past, present, and emerging. I would like to express my gratitude that we share this land today and are sorry for the cost of that sharing. I hope that in the spirit of reconciliation, we can move forward to a place of justice, healing, and partnership as we walk gently on this land. I would also like to acknowledge all people with lived experience of mental illness as we work towards a world in which people with mental illness are valued and treated as equals. So we'll get on with it. I'd like to say a big thank you to you guys for being the guinea pigs for this project. And I think you each bring a particular perspective on open dialogue, which we'll get up onto. I might start by talking to Niels for a little bit, if that's okay. So Niels was a mental health nurse and a professor at Monash University. He's leading an international research group exploring the adoption, implementation, and practices of open dialogue and similar systemic approaches to psychotherapies. Welcome, Niels. So could you tell us a bit about your academic background?
Academically, I originally trained as a nurse. In Denmark, you cannot become a specialist mental health nurse before very late in your career. So I trained as a general nurse, and after a couple of years in what was then called acute psychiatry, I decided that I needed to learn more. I had a hunger for more knowledge and enrolled into a 3-year master's course in nursing. I spent that time reading Bourdieu, Foucault, and Giddens, so primarily sociology, and wrote my master's thesis on genealogy of the Danish mental health nurse.
Very interesting.
After that, I still had hunger, and after being a nurse teacher for a year, I came into a PhD program for 3 years and wrote about social linguistics in mental health wards, doing observations and field work amongst mental health nurses, trying to figure out how they speak about themselves and the people they have in their care. And after that, I sort of drifted into academic work, first as an associate professor at the University of Southern Denmark, and then I moved to the University of Sydney for 5 years, and currently I'm in Melbourne at Monash University.
Okay. I understand you are finalizing a 3-year open dialogue training course. Is that right?
That is right. And that's why it's so important for me that it's not just me, it's also Andrea and Sarah, because the training course at its core had working in small groups as its business. It's very important in order to learn about open dialogue, to learn about your own family and how you yourself work in small groups. And the 3-year training course was done in intense group work with, in particular, Andrea and Sarah, but also more people. But our little group is, for me, the core of my open dialogue training.
And what is open dialogue?
I knew you'd ask that. To me, open dialogue is a couple of things at the same time. I think the most important thing is a particular gentle attitude towards people around you. When it's applied to mental health settings, it's people who have experiences of intense psychological states, but it's that gentle attitude that I try to convey in my language use and in the way I communicate. So it's trauma-informed, it's recovery-oriented, and it's gentle. And that gentleness is one big part of what open dialogue is. And the second part is that it's a particular way of organizing services that focuses on integrated care through network meetings, where when you're doing work with someone, you try to bring all the significant parties together once in a while in order to make sure that everybody's gentle and everybody's up to date in terms of what's happening with people's trajectory through health, illness, and services. So I think those two things are the two defining issues for me in open dialogue. And if I was to be really dialogical, Richard, I would like to hear Sarah and Andrea's response to this question as well, because that's how I would work intuitively. Would that be okay?
Of course. Andrea, what is open dialogue for you?
I think in addition to some of the things that Niels has highlighted, for me, open dialogue really speaks very strongly to being relational and being with others, and has a real openness and collaborative essence to it. So for me, when I think of open dialogue, I immediately think of the other. I think of being with others, and kind of exploring their stories, attending to what others are sharing, and then at the same time attending to how I respond to what they have to say. So for me, it really is that relational core is really central to the way to me kind of thinking about open dialogue and why I like to work in that way.
Okay. I have another question for you, but first we'll ask Sarah what open dialogue has meant in her work and in her life.
I think just as I'm sitting here listening, I am I'm made present very quickly listening to Neil and Andrea's voices. They steady me in sitting here very quickly, and I think that that's a really big part of open dialogue for me, is that I come and I share the responsibility of the space and what we'll talk about together. That feels, yes, collaborative, like Andrea has said, and connected, and relational. And I also think, all these words, they're kind of the word of gentle that Niels used. I think those things are also held within an approach that's revolutionary, and it's social action in practice as we sit and we work very consciously in a way that is very different to the systems around us. And that we have to be revolutionaries to work in this way. So I think as I'm listening to those words, that it also is within a context that is asking us to actually not work in this way. And so, yeah, open dialogue is a conscious way of working that is in opposition maybe to a lot of the models that we're used to working in with young people in particular and children, and also just within the mental health system at large at the moment. Yeah.
So we'll come to that opposition as we talk. I have a question for all of you. As someone who has been diagnosed with a psychotic illness, can open dialogue be an alternative to traditional care for psychosis? I invite any of you to answer.
It's is it okay if I go first?
Of course.
It's a really difficult question because in my work I've been met by people who are really interested in open dialogue as a way to be healed, and my first response is that I need to disappoint people in the sense that there's no magic bullet to open dialogue. It doesn't heal people faster as I see it. In particular, if you're at a very extreme state of mind, you talk about psychosis. The thing that's important about healing and open dialogue is that it stops or can stop some of the harm that the system can do to you when you come into the mental health services, the traditional mental health services that have historically been very brutal industries. So for me, when I talk about gentleness, there's something about being received, heard, recognized in a trauma-informed way that ensures that the system does not add to your problems, but starts to work with you as you're working through the problems that you're experiencing. So I think I'd like to split up a response. There's a response about some people had read or seen a film about eradicating schizophrenia in Lapland, and it's not true. Schizophrenia was not eradicated in Lapland, but they started treating people who came into the mental health services better, which meant that their trajectories through the system and through illness became better. So no, it doesn't cure you, but yes, it can assist your healing in different ways to what the conventional system is usually allowed to do.
And can it apply to mental illnesses? I don't know if you object to the term mental illness, but can it apply to people who have lived experience of mental distress in depression or anxiety or PTSD or so forth?
I believe it can be applied to, I don't think it can harm any situation with any illness, but people have at the same time different preferences as to how they want to be treated. And open dialogue includes an attitude where we're assisting people in doing a lot of work in their social networks, in their families. And some people don't like to work that way. And in that sense, open dialogue is not their thing. They might want to do different types of therapies that have got a better fit for their personality, or their wishes, personal wishes, or their traditions or cultural backgrounds. But from the outset, I have not heard of any situation where an open dialogue situation in itself harms anyone's situation. It might be something that they don't like, but that's normal, I guess, for coming into any treatment setting.
Andrea, could you speak to the relationship between open dialogue and psychotic illness?
Wow, what a big question. I don't think I can speak to that and do it any justice, but I can give you some thoughts, I suppose. I guess when I've been working with people with a whole range of experiences, and some of them may talk about psychotic illness, some of them may talk about other kinds of experiences. I think the approach taken is determined by the person and the people who are meaningful to them, as opposed to necessarily what diagnosis they may be living with. So when working in this kind of way, I guess it comes back to some of those things that Niels was talking about. It is very much an approach that is informed by the individual and the people around them, and a gentle approach, and sometimes a slow approach to that, to really figure out what is the best way for us to work together in this space. What is it that that you might need in your context with your experiences that might be different to somebody else who also has a diagnosis of schizophrenia or some other experience that they are enduring. So I think for me, a starting point is often not what is the diagnosis, but actually to hear from the person around what their experiences might be, what their difficulties might be, and how it is that the people who are meaningful to them in their network may be able to kind of share some of that burden, may be able to share some of looking for ways to support that person more effectively. So for me, it often doesn't start necessarily with the diagnosis as such.
I ask the question because I observe in psychiatry, treating psychosis, that early intervention and the earliest possible medication are generally the main goals. Whereas if you're more gentle and if you're seeking out what people themselves feel to be concerning them, that's not something that you can do immediately and without haste. Immediately and with haste, sorry, yeah.
I think it comes back to thinking about that idea of open dialogue not necessarily being a replacement for other ways of working with people who may be experiencing, as you've said, schizophrenia. It may be an approach that sits alongside some of those other ways of working. It may be that a person may still be, seeing a psychiatrist or having some other form of support. They may be, taking some prescribed medication, some other approaches. They may be working with a psychologist. They may be taking all sorts of approaches that they find of benefit to them, and at the same time may also want to work in a more dialogical, open way. So I don't think it necessarily is about being a one or the other. I think oftentimes when I worked with people in open dialogue, they are still engaged in those other therapeutic approaches as well.
Okay. I'd like to ask Sarah a question, but I think perhaps before I do, I should ask you a little bit about the work that you've been doing in the education system.
Sure. So I am a social worker and I work as a wellbeing coordinator in a kindergarten to year 12 school. And while doing the open dialogue training with Andrea and Niels, I was thinking a little bit about the young people I was working with. and how open dialogue approach might change their experience of how they were talking about their distress in the school system. When I was first working in the school, the conversations that were happening about the young person or with the young person were very isolated from one another. So we started to invite everyone into the room together around this social network approach, and starting with a question to the child, what was important for them to talk about, which would actually lead how that adults would then respond to them. And over the last 5 years, we've actually been changing our system in our school to only meet in this way when something comes up for a child or a young person around their distress or around their learning or around communication difficulties that they're having with adults in the school. And it's been very welcomed in our school from the students and the families, and also the staff much prefer this way of working. So it's been a really very large cultural shift for our school, but there was some real foundations of wanting to support the relationships with one another in the school already. So that kind of assisted our the changes that happened. So that's what I've been doing over the last little while.
That's fabulous work.
Yeah, it feels good, and it's been highly supported by Andrea and Niels. They've come and sat with families alongside me in the school as those changes have happened, and supported the training of teachers. So as Niels started, it's a very much a collaborative effort in supporting the change as well.
And I guess you may have already answered this, but why do you think it's been so successful?
I think that there felt like a yearning when I first started working in the school, a yearning to be more involved in the talk that was happening and be more supported to have dialogue with one another. I think I like the word yearning because it was like there was no space for it to actually occur. So there was kind of all of these voices or people or even relationships kind of happening around the periphery, but this real desire to kind of come closer to what was happening. But due to, the way the system worked or fear around risk or safety, those conversations weren't able to happen. So I think the open dialogue just provided the space for people who already wanted to kind of be sitting in that space to come together. There's kind of a bit of hunger for it to happen anyway. So I think part of the success is that it was just offering a place for the talk that people already wanted to be part of to happen. It's a bit of a no-brainer, it felt like, really.
Okay.
Yeah.
Niels, sorry, any more?
No, thank you.
Okay. Niels, you mentioned gentleness, and I wonder, what is the philosophy behind open door dialogue? What is the theory behind it? Sorry for asking big questions.
I think I think that it's layered, and you can talk about different theories explaining some of the same things. To me, it's called open dialogue, and open refers to the invitation for the family and the social network to come into a conversation. So open is about invitation, but the other side, which is also about the gentleness, is the dialogue part. And I guess that the philosophy or the theory about it, behind it, is that human beings, through dialogue with the people around us, I think within social psychology, they would talk about interactions doing the same thing. And within, I guess, attachment theory, they would also have ideas about how you relate to the world. And through your relating with the world, you become who you are. And when you then transfer that idea into a treatment setting, we very often use the idea of the polyphony, the multiplicity of voices. And that's really dialogue on steroids, that it's not just me and one other person, but rather it's me in a dialogical interaction with everybody around me. And the idea of a polyphony is that you can sometimes get that sense in your gut when you're in a meeting that there's a melody in the midst of, there's a melody of, or there's a super voice in the middle of the individual voices that take place. It's hard to describe, but there's a melody in the melody, or there's a melody in the noise, that something special happens when there's this intense interaction between people who have come together to talk about difficult stuff. And that's the polyphony. So my job is to scaffold that polyphony by being gentle and being inviting, a bit like you are now to Andrea and Sarah and me, that we're invited to talk about not just what we want to talk about, but what the group is sort of hinting it wants to talk about. And open dialogue meetings have a bit of the same form, that we talk about what stuff that everybody's talking about, so it becomes focused. At the same time, it allows for everybody to be individual and hold their own position without having to agree with everybody else, but can be different. And there's a respectfulness of the other, as Andrea used that word previously, that it's about respecting the otherness of everybody else in this polyphony of voices.
On the topic of polyphony, I invite Andrea or Sarah to offer their observations of open dialogue in practice.
I think one of the things for me, and I keep coming back to the word polyphony, but I keep coming back to the word gentleness. I think sometimes when we use the word gentleness, and it may have kind of sounded a little bit at odds with Sarah's word revolution, I think sometimes there can be a potential misunderstanding that gentleness means something quite passive. And when we talk about the slowness of open dialogue, that again, perhaps there's this notion of passivity, and yet it's a very, very active space, and it's not necessarily an easy, comfortable space. In fact, it can be uncomfortable. We can be having dialogue around things that can make us feel uncomfortable.
Mm-hmm.
And I guess part of that gentleness is how we help that dialogue to unfold in a way that feels safe, perhaps. And that's probably a big word to use on its own, but again, that idea of ideas, perspectives in a way that can contribute to something maybe more positive happening. So there is activity rather than passivity, and it's gentle and slow, but that doesn't necessarily mean that it's easy. So there's some of the things I think are coming to mind as I'm sitting here listening to Niels and Sarah.
I have a challenge, I guess, or a problem. Sometimes when people are undergoing psychosis or first onset psychosis, their speech becomes garbled. and there's a phrase which is a bit unfortunate, but it's word salad. When someone is in that state, are they still able to contribute to open dialogue?
I'm going to say absolutely, and I'm actually thinking that it might be really helpful to hear from Sarah. And the reason why I say that is because Sarah, I'm just wondering, because you work with quite young children at times who may have different capability around language and kind of speaking and contributing and sharing in a way that others understand. So I'm wondering whether you've got any thoughts on that, Sarah, in relation to what Richard was asking.
I was just thinking about that idea of making sense, and that part of the idea of polyphony that is so beautiful to me is around making sense actually being held lightly, and maybe our idea of someone needing to make sense doesn't matter so much, and that when we sit, I think about sitting with children or young people in a space at school, and that they might start to use some words that are not words I would use, that maybe other adults in the space or other people in the space wouldn't use, and that we're able to just sit with that, and maybe just repeat the words, or share a word of our own that makes us think of, or how it feels for us to hear that word, or that we might be curious about those words, that we might just talk like this, that Andrea might invite me to comment on my thoughts about hearing these words. And that I think the revolutionary part of the polyphony is that we can really hold off and protect the space, that we actually might spend the entire time sitting together talking about these few words, and that parents might be incredibly moved by hearing these words or hearing our response to these words, that we're not making assumptions about what they mean or what they don't mean, and that is incredibly powerful. That kind of melody, I don't know if Niels maybe used the word, I think you said melody. There's something happening because we're all kind of repeating our response one after the other to kind of these words, this, what did you say? You didn't say fruit salad. Did you say fruit salad? What was
Word
the term
salad.
Word salad,
Word
fruit
salad.
salad. Word salad, right?
If
But
you're
just
feeling a
this
bit
kind of-
fruity.
yeah, that's I think that's the power of this way of working, that there isn't that pressure or expectation or need to be making sense, that we can sit with word salad and let it be what it is. So I don't, always know exactly what that experience is like for a young person who maybe has used words, but I think my felt sense of the space is that they feel like we have really honoured the space for them to just be in those words with us, and that we've heard them. Yeah. Thanks for the invitation.
Yeah.
I was just saying thank you for the invitation to share, Andrea.
Sarah, you've done a TEDx talk about your work. Can you tell us a little about that?
Yeah, I had a sense that the sharing about this work was a little bit locked into certain contexts, and I was invited to maybe share and see, just how it might be heard by a bit of a broader context. So TEDx is kind of a nice tool to be able to share ideas a little bit more broadly. And so in that talk, I just spoke a little bit about, my own experience of trying to find my voice as a young person and continue to need to take it slow as an adult also, and just how this way of working has supported me, and also how, yeah, I feel it's supporting others in the work that we're all doing. Yeah, that was
If
what the
people are interested,
yes.
should they email your Google your name?
Yeah,
Or-
yeah. I've got a unique names and not a huge presence on the internet, so you can find it pretty easily.
Okay, so that's Sarah Farrell-Whelan.
Yeah.
Niels, I'd like to come back to something you said earlier about the nature of the self coming out of relationships with other people and through interaction, I think was the word you used. When you see a psychiatrist, your experience of reality and yourself is very much located in the chemistry of your brain, even if the psychiatrists don't always understand that chemistry. Do you think open dialogue poses a challenge?
In what sense do you mean challenge?
Rather than seeing the self as a biochemical expression of biochemistry, seeing the self as an expression of social interaction.
I think I'd rather not go psychiatrist bashing.
Okay.
I think most psychiatrists would recognize that there's more to a person than biochemistry. I believe that sometimes there's a tendency to jump to the conclusion that the need here is for someone to have their biochemistry altered or pushed back into a pattern that allows them to live in less interruption of a community or with less psychological pain. So as Andrea said before, it's not an either or. It's not open dialogue or biochemistry and medicine and reducing people. I think it's both and that in most situations, a dialogical approach would be accompanied by medicine and psychiatry in its old-fashioned sense of trying to cure people with medicine. I think the novelty here is the speed with which decisions are made, that people and families and social networks need time to make these big decisions about what's going to happen next for us. And rather than just giving people medication, and which will quiet most people down because it can put you into a bubble where you cannot think and you cannot work with your issues and you cannot really interact with the world around you. That I believe that medication definitely has a place in the treatment of psychosis or most mental health problems. Or if it's helpful for this person after careful consideration, definitely go for it. As long as it takes place at a speed and with the right people involved, I can only support that. I would, and it's a personal opinion, I would go as slow and as little as possible, and I would try to get out of it quite soon, rather than thinking I need to take this for 10 years or the rest of my life. I will try to get out of it as soon as possible, so that the inner balance of my biochemistry isn't completely altered by adding to it, but rather trying to find a new homeostasis.
Yes.
without the added chemicals. So I guess I'm a little bit waffled, and I apologize for that. But for me, it's not a medication or dialogue, but definitely it's not medication alone and it's not dialogue alone, but it's, I guess you could see the voice of the psychiatrist and the voice of medicine as part of the polyphony. And it's important to have those perspectives in there, as long as they're not allowed to be silencing voices that do not respect the otherness of the other voices in that polyphony of voices, if that metaphor makes sense.
Yes, it does. If I could reflect back on what you guys have talked to me about today, I think the concept of gentleness has been very important. The idea that each person has an opportunity and maybe even a right to be heard, even if what they say is uncomfortable or confused. I hear that it is not an alternative to mainstream medicine, but it is a way of practicing that medicine in a way which is somewhat more socially engaged and, to use this word again, gentle. I would like to, before we end, I'd like to invite you to maybe tell a story of a successful open dialogue therapy session or series of sessions, or perhaps express what you think open dialogue could be in Australia.
Can I interrupt, Richard? Just before we go, and then I'm just thinking about, appreciate your question, but I'm thinking about someone watching this, someone like me that doesn't know much. We use the words such as therapy sessions. For someone outside listening to this or seeing this, is it how does open dialogue, or how can people access one, and how does it work? Is it like a session with a psychologist? Is it therapy? How would you explain? I think the question is, how do you explain how open dialogue would be included in a therapy session? So yeah.
I invite you guys to answer to Gus. Andrea, any thoughts?
Gee, you asked some big questions that don't necessarily have easy, straightforward answers. So I'm very much going to rely on Niels and Sarah to jump in also whenever they feel inclined to do so. I guess as a starting point, what I would say is that we talk about open dialogue as being a therapeutic approach, I guess, and it's kind of a broad sense. And I guess like other therapeutic approaches, people are trained or undergo, some engagement and learning about the approach. And so certainly, Niels and Sarah and I have all done open dialogue training of 3 years, which had a lot of theory work and some of what Niels referred to earlier in terms of the working together very closely with other people who were learning alongside us, as well as, I guess, working with people who are experiencing, altered states, mental illness, psychosocial challenges, whatever kind of term you want to think about. So to come back to that idea of, is there a therapist? Is there a psychologist or a psychiatrist or a nurse? There is ideally, yes, there is a coming together of someone who is open dialogue trained or an open dialogue practitioner. They may very well be working with somebody else who also has some of that training potentially, but it is also about then coming together with the person of concern, the people that they identify are important, who may be able to, contribute to kind of the dialogue with them. And that could be family, friends, it could be other people in their network who they are engaged with more formally. It could be a social worker, it could be a counsellor, it could be a psychologist. It really is very often determined by, who's going to be the helpful people to come along and join a conversation or dialogue. And when we talk about this idea of a session, there is some form around kind of coming together in a space, hearing from each other and actually having that dialogue facilitated. And so that dialogue is often facilitated by the person who has some engagement and training in open dialogue. And as I said, commonly they may also be working with another therapist, open dialogue practitioner in that space, coming together for a meeting to share thoughts, discussion, dialogue, or also to sit in silence and be quiet and sit with our thoughts and be conscious of how we feel in response to what may or may not be said. I can see that Sarah is sitting there with a smile on her face as she's hearing me struggle my way through this. Sarah, I'm wondering if there's anything coming to mind to you in terms of the way that we come together with people in what we kind of call a network meeting.
I was smiling, Andrea, because as you're explaining it, I think it's difficult. I think it's difficult to explain. And my smile is because as you explain it, I just picture you sitting next to me. So that I think the big part of working in this way is that there ideally is two facilitators. So you have a co-therapist, and just the beauty of that. It actually makes me think of a family that Niels and Andrea and I have all been involved in supporting, in working in this way. And I think part of the meaning making for this family, a young person and their parents, in the talk that they were able to have, it was actually a number of sessions in which the young person shared very few words. And what actually happened was that the crisis that we were coming together for, totally the crisis that everyone thought they were coming together for actually changed to a different crisis. So I was thinking a little bit when Niels was, kind of talking about, who's engaged and open dialogue, and having dialogue is kind of a part of many other types of, kind of treatment as well. And I think for me, the really key bit is that being dialogical means that there is space given to the meaning of why we're coming together being able to change. And so for this young person who I think the family really believed that the issue and problem and crisis was within this young person, who found it very difficult to articulate their experience in the world, actually became reconsidered as a crisis actually within the communication of the family at large. And so I think that was very, very significant for their family, and was really able to happen due to the way that we were kind of able to sit together in a very kind of slow way. So that's just kind of what I was thinking about as you were kind of talking, Andrea, because it is difficult to, I think, explain the mechanisms of this way of working in a smooth way. Yeah.
Richard, just to summarize, I just want to piece it together so I can explain. So maybe let me try to explain this back to you. Open dialogue is a kind of a certification where experts may go after finishing their degree or something, go and do, and people can choose to find those, and then they, or if they find someone that use that kind of certification, they might engage with other people that in a network manner somehow. So it's not something that I want to use the open dialogue today. It's more like finding the person that is certified in open dialogue, and then you access that network of people. and strategies. Is that correct?
It's tricky in the
Sorry.
sense that it's tricky in the sense, Gus, that there is no formal certificate for someone to be able to call themselves open dialogue practitioners or psychotherapists, and it's tricky in the sense that for some people this way of communicating is how they communicate, and I've met people with no training in open dialogue who, in my mind, are amongst the best psychotherapists I've ever met, and the people I really would want to draw on if I or my family ever got in a situation that needed this type of help. At the same time, I've seen people with lots of training being absolutely rubbish at it, even though they were full of good intentions. But I guess that's something we share with any psychotherapy, that it's, you can have a piece of paper, but it doesn't really guarantee that you're good or bad, but it gives you a hint that probably it's helpful to go and see you. There's a bottleneck problem in Australia that we don't quite have enough trainers to be able to train open dialogue therapists and provide them with the supervision that's needed for it to become an alternative that will be accessible for the mainstream Australia. So it's problematic, and it's also, as Sarah said, it's revolutionary, which is an issue. And maybe, I'm just throwing it out there, maybe open dialogue is meant to be on the fringes and being something revolutionary that can inspire the established system to move towards families and towards less medication and things like that, rather than become a thing I often think about. I'd like to just, I know I'm aware of time, but Gus, you asked what happens when you come into a meeting. Andrea have spoken about bringing people together, and Sarah have spoken about how you then can have a co-therapist. I think it was Sarah. The beauty of that is that when you're in a conversation, where you thing you would do as a therapist is to ensure that all voices are being heard. So when you come to an open dialogue session, the one thing you can rely on is that your voice will be heard, and there will be someone holding the conversation and ensuring that everybody is heard during the conversation. And in that part of the conversation, the practitioner or the people holding the conversation will contribute with very little about what's going on inside them. It's more a question of making sure that people are actively in dialogue with one another and respecting and acknowledging each other's position, rather than bullying each other into a consensus. You need medication, you have to take it right now. That's a really good point, but there's an otherness as well. There might be another way of looking at it, and let's explore that way of looking at it. At some point in the conversation, if there are two therapists, they can ask for permission to reflect on what they've heard and turn away from the family and have a conversation about how they feel and what their thoughts are about what's going on, which is sort of, I know I spoke about, maybe that's the steroid part of dialogue on steroids, that the reflection becomes then another layer of thinking about the things that have been said, maybe in a bit the same way as the word gentle has been bouncing back and forth between us as conversationalists today, that it's not my word, but it's a thing that sort of became slightly different whenever someone picked it up and started using it. And that's what happens in that reflective space where you have a conversation about the conversation. And these two people having the conversation will turn back to the big group and ask, did anything come to you as you heard us talk about what has been spoken about? And that's where the personality and what goes on the inside of the therapist becomes part of the conversation as well. And then the family continues to talk about what their issues are, maybe assisted by what came up in the reflection, and maybe the reflections didn't make any sense to them, and that's also something that happens. It's an offering that people can use or just let go. And that routine of listening to the family, having reflections, going back to the family, listening to all the voices, is part of facilitating or holding or assisting the polyphony of voices that we believe could allow for something unspoken to be said and could allow for change in the family. But it's not something that we insist on must happen, and we insist on changes having to happen. It's a place of potential and putting voice to the things that are not said yet.
Thank you.
Well, I think it's about time to wrap up. I'd just like to thank Niels Buus, Andrea McCloughen, and Sarah Farrell-Whelan for coming here and talking to us today about open dialogue therapy. And we'll be with you in another 3 months or so. Thank you so much for listening.